Hi my loves, it's Sheena and I'm back with another video. So on today's video, I will be talking to you guys about a complication that I had with my surgery. Recently, I just posted a video. It's already on my channel. It's about it's a vlog about my experience in Colombia with getting plastic surgery. And I just wanted to I said that when I had surgery this time, I wanted to take y'all my channel, on the with me. I wanted to vlog this experience so that people can kind of get an inside look on what it's like to get surgery out of the country. So I put the vlog up. Y'all know this is probably my second vlog that I've done. So it wasn't perfect. The editing, I wasn't happy with it, but I went ahead and posted it anyway so that y'all can just get an inside look of what it's like. So go ahead and check that video out if you haven't already, okay? So, but on today's video, I'm going to be talking to y'all about something that's taboo, okay? Like, surgery is already taboo. A lot of girls will never admit that they've had surgery if they did anything to their body. That's just something that still a lot of girls aren't admitting. Like, things are changing now. Some girls are starting to be more honest with whether or not they had work. I'm one of them. Like, I'm not hiding it at all. You know, I feel like if this something that you want, go after it. You know, it's always good to invest in yourself, and surgery is definitely an investment in yourself. Okay, so I don't have any problems talking about, my whole surgery experience. And I also wanted to come on here, not only just talk about my surgery experience, just give y'all like the real, okay, the good, the bad, and the ugly. I want to make sure that I'm transparent with this thing. I just don't want to talk about the good and not tell y'all some of the things that I went through as far as a complication goes. That's taboo, because some girls that will talk about their surgery, they won't tell you about the complications that they have. And I'm not sure why, what the reason is, if they're afraid of backlash or whatever. But me, I'm just gonna put it out there and tell it like it is. So for those of you that don't know, I had lipo to my back, upper and lower back, my sides, my stomach, my inner thighs, and I also my doctor added in chin lipo as well. I had my breast done. I had a breast lift and reduction. I say a reduction too because when you get a breast lift, it automatically comes with the reduction. Sometimes they'll take a little bit off, but I asked for her to kind of really do a good reduction because I was a 40 triple D and I wanted to go down to a C cup. So she took a little bit more off when she did her lift. So that's why I say a breast lift and a reduction. And I have implants, high profile implants, 400 cc's. And the reason why I got implants, I didn't have to get implants because I already, like I said, was a 40 triple D. I was already 40 triple D, but I chose to get breast implants because I wanted the upper pole fullness. As you can see, I wanted them to sit up like this. And if I would have used my own breast tissue, this part, I wouldn't have had this part. And so it's under the muscle, which means that I have a more of a natural look, but I still have that fullness at the top that I wanted. So that's what I opted for. Now, I had surgery on May 30th, which was on a Friday. I stayed in Colombia a total of 16 days. After I had surgery, because I got lipo, I had to get massages. So I actually had to go to the clinic, Dr. Jacome's clinic, and I had to go, her doctor's office, doctor's office clinic, and that's where they did the massages. And I'm gonna just go ahead and tell you, when you get surgery in another country like Colombia, South America, if you don't know the language, if you can't speak Spanish and you don't have someone right there translating for you, you could use Google Translate, but a lot of times with Google Translate, you can only say like so many words. If you say longer sentences, like it's not going to translate very well. So if you don't know how to speak Spanish and you don't have a translator, it can be a little rough with trying to communicate, okay? So no one, well, I'm not going to say no one, because there were people that spoke English in Dr. Jacome. Well, Dr. Jacome speaks English, and she may have, and yeah, and then everybody else is very like broken English, okay? So the lady who does the massages, or she's over that part of the massage, she could not speak any English at all. But thankfully there were girls there with me who was bilingual, and so they would translate for me. But the lady told the supervisor that's over the massage, massage part of the clinic, she told me that my nipples, she suggested that I get carboxy treatment. Carboxy treatment is basically a needle that they stick into your nipple to speed up the healing process. So she was like, it was translated, and they were like, okay, it was translated, and so she was basically like, she recommended that I get carboxy treatment just to make my nipple heal faster, because during the surgery the doctor was saying that it didn't attach how she wanted it to. That's how it was translated to me. So because I didn't hear it from my doctor, I was kind of hesitant. I was honestly thinking, oh, maybe this is just something they're trying to upsell me, because things like that will happen a lot when you have surgery. I can't speak for any other place, but in Cali, Colombia, there's going to be a lot of upselling. I'll just go ahead and tell you that. So I just thought that this was just, something she was trying to upsell me on. And so I initially told her, okay, I'll do it. It's like 5 treatments. I think it was like $80 for 5 treatments. I can't remember. Or maybe it was $100 for 5 treatments. But initially I told her, sure, I'll do it. And then I thought about it. I was like, okay, before I do it, she did a session on me. And then I thought about it. And it hurt so bad. So it's basically a tiny needle that they're sticking around your nipple. This shit hurts so bad. So I was like, is this necessary? Like, am I going, like, is this necessary? The doctor didn't tell me I should do it. So I told her, I said, before we do the other 4 treatments, let me, I need to talk to the doctor, okay? And so I ended up getting a follow-up visit with my doctor. I'll go ahead and tell you this. I only had 1 follow-up visit with my doctor. I think that's normal, because I think the last time I had surgery, it was the same way. I only saw my doctor like 1 time before I left. They looked at me or whatever and checked me out, see how everything was healing. So that's how she did. She checked me out. She was like, okay, you look good, She's like, yeah, go ahead and get the carboxy for your nipples, just to make sure everything is healing. But she was like, you look fabulous. I'm like, okay, thank you. So I went ahead and did the other 4 treatments of the carboxy. Now, I already knew, because I researched before I had surgery, that once you get a breast lift, especially breast lift with implants, you have to be very careful, because your incision can open up. And that's very, very common. And so one of the things that prevent that from happening is just making sure that you're not lifting your arm up over your head. Like you can't lift anything over your head. You can't lift anything heavy. Your arms need to be at your side as much as possible. And then like you can get help getting in and out of bed. And so that's what I did. Like I was very, very careful, because I didn't want my incision to open up. Now, like I said, the language barrier it's like, that part sucks, because especially when nobody in the office can speak English. Okay, so, you know, I'm steady asking. My boobs are taped up. You know, I'm taking my shower. I'm not getting my incisions wet, because that's another thing that, you know, you're not supposed to get your incisions wet in the shower. But, you know, once they took the tape off, you know, they was like, your breasts are healing. Fine, you can go ahead and take regular showers. So, okay, that's what I did. When I got back home on, I think it was June the 10th is when I arrived back home. The next day, I had like a slight pain in my right breast. And so I go and look, and my incision is opening up. Like, y'all, I'm like, oh my God, like, I'm freaking out. I'm like, why? You know, I did everything possible that I thought that this wouldn't happen, and the incision is still opening. So I took a picture of it, and I sent it to my doctor's nurse. So she got back to me. She said, okay, the incision is opening up. Put some ointment on it and cover it with gauze. So I'm thinking, okay, I didn't ask her like what kind of, she said put some healing ointment on it. So the first thing I'm thinking of it is Neosporin. That's what I, you know, because I was in I'm in the surgery groups, and I remember one girl said this happened to her and she put it on her boob. Okay, let me go ahead and tell y'all right now, I'm just gonna put the disclaimer out there. I'm not a medical professional at all. I'm not giving medical advice to anybody. I'm just telling y'all what I did in the process that I went through. Okay, if you have any complications with surgery, go ahead and reach out to your surgeon and do what they tell you to do. Okay, what they recommend. But if what I'm about to tell you, if you do it, you're doing it, you know, of course, is on your own. So, but I just had to put that out there. So I put the Neosporin on there, and it helps. Okay, it seemed like it was closing up. Then all of a sudden, my nipple, around the top of my nipple, starts to open up too. So I put some of the Neosporin on there and put some gauze on it. Wrong thing to do. Do not use Neosporin. Sometimes, you know, like I said, I'm in the surgery community, and I'm in the surgery community because you can get like advice from other dolls who are vets who've had surgery before. You can just hear about their experience if complications come up. Like, it's a wealth of information in those surgery groups, as well as on Instagram and Real Self. But that putting Neosporin on your breast is a no-no. I later found out that it's an ingredient in it that is not good for like open wounds, because what started to happen was it started to irritate my nipple, and the little at the top, the incision, it got worse. Now it didn't, the bottom part was fine when I put the Neosporin there and the gauze over it. Like, it started healing. But when I put it on my nipple, it's like my nipple started to unravel. Okay, like it started to open up. So I'm like, oh, this is looking worse. Like, I'm looking at it every day. I'm like, oh, it's not getting better. It's just getting bigger, and then it's like, y'all, I'm gonna show y'all a picture, but I'm gonna go ahead and warn you, it looks gross. But you know, I'm here to give y'all the real. Like, it was looking bad. And so not only that, my nipple, and this is the left side is doing just fine. Okay, it's healing perfectly. This right side is giving me hell. Okay, pure hell. So it starts to open up, and then it starts to turn black. My nipple starts to turn black. So I'm freaking out. Okay, I'm like, oh, it's like really, really dark. I'm noticing like how dark it is. So I take a picture of it and send it to the nurse. It was I didn't expect for her to get right back to me because it was late at night when I sent her the message. I was like, I'm just wait until she messages me in the morning. So in the meantime, I posted a picture and I put it on my Instagram. And so a lot of the girls who've had surgery, vets or whatever, they were like, oh my God, it looks like necrosis because it's turning black. You need to go to the emergency room. So I'm like freaking out. I'm like, oh my God. I'm Googling, I'm looking up necrosis of the nipple, and I couldn't sleep. I'm scared. You know, I'm like, I put this Neosporin on my boob, and now I messed up, like, what, you know, and I felt like like the nurse, the doctor, they should have told me, like, what type of ointment. She just said healing ointment. So I just figured, okay, Neosporin, because I heard a girl did that in a group. But, you know, I'm freaking out. So I'm like, okay, you know, first thing in the morning, as soon as I get up, I'm going to the emergency room. A lot of girls, when they have the thing about getting surgery, one of the things, like when you get surgery out of the country and you try to go to the emergency room, like I've heard from a lot of girls, like they treat you really bad because you went out of the country to have surgery. So it's like you're a liability, and a lot of times they don't want to touch you, or, you know, there is going to be a lot of judgment there. So I was like, okay, this is like the last thing that I want to do, but I don't want my nipple to die. I don't want my nipple to fall off. Okay, so the next morning came, and I'm like, okay, I'm gonna give it a little time. I'm trying to hear from my doctor, but I'm like, I don't know if I need to just go ahead and go to the emergency room. But I'm going to just wait and see what she has to say first. So I decided I was just going to wait and see what she has to say. So the nurse messaged me back and she said, can you send a video? The doctor wants to see a video. So I recorded a video, and she comes back and she said, it's completely normal. It's dead skin. It's going to fall off. And once it fall off, then you need to make sure that you get your ointments, and you need to get some gauze and cover it up, and make sure you put your ointment on so that when you put the gauze, it doesn't peel the skin, the skin that's healing, it doesn't peel that off to start the healing process over again. By that time, I had ordered some honey off of Amazon because I ordered it for the bottom incision. That had arrived in the mail. So I'm like, okay, I'm going to just start using the honey, and I'm going to start using, instead of I asked her, I said, okay, so what type of healing ointment are you talking about? And she said, Destin. And I'm like, Destin? The only Destin cream that I know is like for diaper rash for babies. I didn't know that they had a healing cream. So I went to CVS and I picked up this, and this is Aquaphor. This is healing ointment, if y'all can see that. So this is what I got along with manuka honey, okay, and wound wash. All right, so when she told me that, I was like, okay, it's not necrosis. It's dead skin. I'm not kidding y'all. As soon as she told me that, y'all, the skin started to peel off the nipple. Like the same day. Like a couple hours after she told me that. The black skin came off. And so now what's exposed is this pink nipple. Open wound at the top of the nipple. So, it looked gross, y'all. But I was glad that it wasn't necrosis. So what I did was every single day, I got some sterile gloves, I got some gauze, my wound wash, manuka honey, and this Aquaphor, and I literally clean my wound every night, and I put these two things on it. And when I tell you, it started to heal almost like instantly. Like it started to just heal real fast. And I started doing like more research, and I really believe that this manuka honey is what saved my nipple. Come to find out, what happened to me is common. Like it happens to like quite a few girls. There's one particular doctor, I'm not gonna call his name, but quite a few girls lost their nipple because of the same type of situation, and the nurse from that doctor told them to just put ointment on it, and then they ended up losing a nipple. Like, it got infected, it got real ugly. So if you're not, like, that's why they say, like, aftercare is very, very, very crucial to the healing part of your surgery, because things can happen, and a lot of times they do when you get home. So come to find out, this is just something that happens quite often. And that's the whole point of me making this video, because I'm like, if I can share this information with another doll, they don't have to go through the same thing that I went through, or if they, you know, are going through it now, they'll know how to take care of themselves. But like I said, I'm not a medical doctor, but I'm just saying that, I'm just telling y'all what worked for me, and it was definitely this manuka honey. I'm gonna leave I got it off of Amazon. I'll leave the link below. I got it off of Amazon, so I'll leave the link below if you want to get some of it. I'm telling y'all, like, if you're getting, I would even just get this if you're having surgery, where you're getting like cut, like a tummy tuck or a breast lift, anything, anywhere they gotta cut you. Make sure you go ahead and pick you up some manuka honey just in case, because you just, like, this stuff is good, and you just never know if you're gonna need it. So I found out about the manuka honey too in the group, so thank God for the groups. If you want surgery, make sure you go on Facebook and join some of those surgery groups or whatever, so that you can have some support. Like I said, some of the information that they give out, like, you can't take everybody's advice. You got to listen to your doctor, do some research, and use common sense. It's unfortunate that things like this is happening, but it's just one of the risks for surgery. You know, surgery is a risk. Surgery is a risk in itself. So, you know, if I can help somebody save their nipple, then I'm all for it, okay? Because that's horrible. I could not imagine actually losing a nipple. So this is what my nipple looks like today. Show y'all pictures. Like today, I just have a little bit at the bottom that's needing to heal. Once that's healed, then I'll be perfectly fine. As you see, like, the color is coming back in nicely. Like I said, I honestly believe it was the manuka honey and me just taking care of it every day that, you know, got it back on track to the healing process. So definitely get you some manuka honey. But this was scary. Like, this was so scary. I'm just glad that things are better. I'm glad that it's better. What I found out is that a lot of times doctors, because with me, okay, I was a 40 triple D. A lot of times doctors will tell you that you need to split up the breast surgery. So, like, if you're like with me heavy chested, it's best to just go ahead and do the reduction first, and then come back and get implants if that's what you want. Because what happened was, and this is just my research that I've done, they say that when you get a breast lift reduction and implants at the same time, the implants is weighing down heavy on your incisions, and that's why they pop open like that. So it's better, you know, to split them up. The doctor should tell you that. I mean, like I said, Dr. Jacome did a great job. She did what I asked her to. You know, I told her this is what I wanted, and she delivered it. It just came with, you know, a complication like that. But a lot of doctors, because of that complication, a risk of that complication happening, they'll tell you to, like, split up the surgeries. But I feel like, because breast surgery is just so meticulous, like, the surgeon has to be so meticulous with cutting you and everything. I would suggest, if you're getting, like, if you wanted like lipo BBL and your breast done, have your breast done in a totally different operation. Like, get your breast done first or get your breast done last. Like, separate it, because the healing process, like it's not that easy to heal from, because it's just not. Like, you're trying to take care of your lipo, then you're trying to take care of your breasts, and it's just a lot. Okay, so you can go ahead and do it all at the same time, but just from my experience, I would suggest separating them if you can, and you know, it'll just make things easier. But overall, like, I'm happy. Like, I'm really happy with them. I love this part. I love how they sit up. They're the perfect size. Dr. Jacome did a great job. It's just I think a lot of it was the language barrier. She didn't really give me instructions on how to take care of my breasts until like the last day I was leaving, and it would have helped if I would have gotten this information before. And once I seen like that little split, like, I wouldn't have gotten it wet in the shower. That's another thing. Like, if your incision does open up, do not wet it. It doesn't matter if you were already taking showers and your incision starts opening up. Do not wet it, because it's just going to make things worse. And then you can risk infection. Like, that's the thing. Like, the whole infection and necrosis, like, shit can get real with this surgery, y'all. So take care of yourselves. I hope that this video helped y'all. If y'all want me to go into more detail on how, you know, I did this, like, please message me, follow me on Instagram, DM me, and I'll be glad to, you know, tell y'all how I did it. But it's really easy. You get your gloves, your sterile gloves. Make sure you put that on. Get your wound wash. Wash it. You know, you just take some gauze with the wound wash, clean around it, and then cut you another piece of gauze, and then apply your ointment and your honey. You're gonna need this ointment because you don't want the honey to stick to the you don't want to make the honey stick to the gauze, and when you pull it off, your skin comes off, and it just, you know, it's gonna make things like even worse. So this will help it like not stick, this ointment right here, and it'll help it. I think these two together is very powerful. So that's my take on that. Y'all have any questions, leave them in the comment section. Please share this video. Share it, share it, share it. It can save somebody's breast. Let them know, you know. And again, like I said, the best thing to do is just to talk to your doctor. But sometimes there are some surgeons that once you have surgery with them, like, it's hard to get in touch with them, unfortunately. So you have to unfortunately, girls will have to rely on videos like this. But, you know, do your best to talk to your doctors first. But I definitely recommend this manuka honey. I do, for the incisions that open up if you have that problem, even on your tummy tuck. This right, do some research on manuka honey. Manuka honey can actually stop necrosis. It can stop necrosis, and it actually helps too with the scarring. And I think that's probably why my scar isn't so bad. And like the lip scar, that's a scar that like a lot of girls like hate, and mine is so thin. Like, she did such a good job. Like, yeah, I can't hate. I mean, not hate. I can't say anything. Oh, I got something in my hair. I can't say anything bad about her work, because she's a good doctor. She is. When it comes to her work and like her skill, she's good. But as a patient that's getting surgery, it's important that we do our, we do our due diligence too. We do our part. We make sure that we're healthy. We make sure that we research the pros and cons and everything, and just, and then, like I said, shit happens. So, but y'all take care, and I will see y'all on the next video. Bye, y'all.